Welcome to the Saul's Newsstand News Rewind for August 13th, 2021. Be sure to stick around after the newsreel for a special Senior Spotlight feature from the 60 Plus Association. An important op-ed by Senator John Thune states, Biden and Democrats' reckless tax and spend spree would decimate family farms and businesses. The U.S. tax code allows family-run businesses to be passed down to the next generation without imposing capital gains taxes. After all, many of these gains are unrealized. The price of land may have risen since being owned by previous generations, but farmers aren't seeing an actual penny of gain. It's called step-up in basis, and it prevents families from paying a fortune when a loved one dies. But the Biden administration is targeting this long-standing part of the tax code as it scrambles to pay for its far-left crusade to permanently grow the federal government and fund the massive tax breaks they're proposing for wealthy Americans in blue states. This proposed tax, the Democrats' new double death tax, could threaten our economic recovery and potentially jeopardize the future of agriculture in America. It would be profoundly unfair to America's hardworking farmers and other generationally owned businesses, and it would particularly devastate rural communities and small-town jobs. Every single Senate Republican stands in opposition to the president's proposed tax hike on family businesses and has signed on to my letter to the president urging him to abandon this misguided tax. But we won't give up if he doesn't. Family-run businesses and farms have weathered the worst in pursuit of the American dream, and they deserve better from Washington. An op-ed by Saul Anuzis urges, protect drug access in Medicare. In one recent survey, 87% of seniors said their Medicare Part D plan provided good value. 93% said the plan was convenient to use, and 89% said the plan delivered what is promised. It is a very rare thing when a government program works better than advertised, costs less than estimated, and is wildly popular with the people it serves. And yet some of our political leaders want to dismantle it. Democrats in Congress aim to repeal a key part of Medicare Part D, known as the Non-Interference Clause. This clause has protected patients' access to critical medicines by making sure that government officials don't get to decide which medicines are worth covering. Proponents of getting rid of the non-interference clause believe that if the feds could only step in, they would push prices lower than those achieved through competition. The success of Medicare Part D did not arrive in spite of government's absence from negotiation and price setting, but because of it. The buying power of 46 million diverse customers drove down prices and expanded coverage. If this measure were to pass, many seniors and people with disabilities would find themselves suddenly without coverage for the drugs they rely on. Some would pay out of pocket, many would skip their unaffordable medicine and get sicker. Quality of life could suffer, and lives would be lost. We would pay in dollars too, as government intervention would end up costing the system much more money down the road. In practice, government price negotiations would severely hurt not just today's seniors, but tomorrow's as well. And finally, Fox Business reports, Social Security cost of living adjustment could be largest in nearly 4 decades. Social Security beneficiaries might be in for the highest cost of living adjustment in nearly 4 decades, according to new projections. The latest estimate from the nonpartisan senior advocacy group, the Senior Citizens League, puts the 2022 cost of living adjustment, which will be announced in October, around 6.2%. The previous adjustment was 1.6% in 2020. Cost of living adjustments, which began in 1975, are implemented in order to counteract the effects of inflation. In this Senior Spotlight, 60 Plus takes a look at RID, Committee to Reduce Infection Deaths. As the pandemic subsides and patients are encouraged to get the medical care they've delayed, Reduce Infection Deaths is ready to help. RID is committed to curbing the spread of bacteria and other pathogens inside hospitals and nursing homes. Whether you're finally getting that hip or knee replacement or any other procedure, RID's 15 Steps checklist can help you reduce the risk of a healthcare infection. You can download a copy of this checklist from their website and review it a week before your procedure. Just visit hospitalinfection.org. If you're choosing a nursing facility, RID's 10 Steps checklist is for you. Often when a patient is discharged from the hospital, it isn't possible to go directly home. The hospital staff will urge you to transfer to a skilled nursing facility, perhaps for a week or two. Moving to the wrong nursing home can be dangerous to your health. Nursing homes have even higher infection rates than hospitals. The difference between a quality facility and a poorly operated one can determine whether you have a speedy recovery or endure terrible health setbacks, including infections. Visit hospitalinfection.org and download or print RID's 10 Steps. The checklist will help you make the right choice and avoid these dangers. For more information and for other Senior Spotlight videos, visit 60plus.org. And that concludes your Saul's Newsstand News Rewind for August 13th, 2021. For more political news faster, visit saulsnews.com.